Hey everyone, Dr. Ryan here from Fundamental Health. Tonight I'd do something very special, I thought, and I would shoot a live video of an actual treatment. I want to demystify what chiropractic is, and I know a lot of people have fears about what chiropractic is or coming in and get treated. So I want to do a special live video of an actual patient, me working through them, and then you getting to see exactly what takes place so you know what to expect. So we'll come on in now. Hey Brittany, how are you doing?
Good, how are you?
Good. So this is Brittany. She's a patient I've been treating for a while now. How's everything going today, Brittany?
My mid-back has felt a lot better, and I've been sleeping a lot better, but my neck is still tight. But ever since the adjustment on Monday, I've slept better. My headaches are better too.
Good. All right. So Brittany, why don't you come lay on your back? So as usual, I'll start with the neck, and then I'll kind of work my way down, and then I treat the full body. So what I do always, when I have the patient lay down on their back, then I'm going to feel around in their neck. What I'm feeling for is a joint that's locked up and not moving the way it's supposed to. That's an unhealthy joint. What I need to do is I need to get it moving as quickly as possible so that you can have return blood flow to the area and the tissues can heal the way they're supposed to. And maybe you've heard it before, but maybe you haven't, but movement is life. If the joint's not moving, if the blood's not moving through the vessels, you're going to have problems. So movement is life. So what I do is I come feel around. Brittany can probably attest, but this feels almost like a massage.
It's kind of nice.
So I always take the time to explain what's going on with new patients too. Brittany is not a new patient, but for everyone who's tuning in right now to watch this, this is what's going on, and I like to warn you before I do anything. So I feel around until I find that area that needs to be adjusted. Now that I found the area that needs to be adjusted, what I'm going to do is I'm going to do a quick movement. There's no whipping of the head or anything like that. So I turn her head like this, and I bring the ear over. Now I have her in the optimal position. My thrust is straight towards the chin. Like I said, there's no whipping or twisting of the head. This isn't Hollywood. I'm not trying to snap necks or anything like that. It's a very safe maneuver. You may hear a noise. That noise is a gas release in the joint. It's the same thing as if you crack your knuckles. It's just a gas that builds up in the synovium of the joint due to pressure. Once I release that with the adjustment, it makes it sound like you're cracking your knuckles. So here we go. And that was C2 on the left. And we'll come down right there. It's about her C5 on the right. So we do the same thing the opposite way. That one's a little stubborn today.
It was Monday too.
We'll try one more attempt here. Making me work on live video. Good. So I'll show them something different. Now I'm going to have you flip over. I'm going to work from the bottom, and then we'll check that in the back.
Okay.
So sometimes when somebody's really tight, the best thing I can do is use this little device. So this is an activator. That's what we call it. It basically provides an impulse. It works as my hands. It's a little lighter force. That way I'm not forcing the joint into movement, because you wouldn't like me if I did that. So by using this device, I can get the result that I'm looking for, at the same time not overpowering the patient or causing them any more pain. And this doesn't feel too bad. It feels a little strange the first couple times you have it done, but like I said, it gets the result. I check it afterwards, the joint's moving, and that's what we wanted. So now what I'm going to do, just because this table's a little high, I'm going to come check the low back, and then we'll move down there for the mid back. So what I'm going to do down here is I'm going to use what we call a drops. So a drop is where the table comes up like that and then drops down like that. That just makes a loud noise, but what the table does more than anything is it allows me to go a little faster, a little harder with my thrust that I'm going to do without hurting the patient. So I'm going to come down here and I'm going to work right on her sacrum that's jamming into the hip over here, and I'm going to try and unjam it. Usually when you're using a drop, take about 3 to 4 different thrusts to get the result you want. all that's okay. Now we're going to move to the right table, and I'm going to do the rest over here.
Okay.
So I'm going to have you on your right side, and you'll face me.
Okay.
So now I'm going to do what we call a side posture adjustment. It's typically for the low back. Her L1 is out of place. So what we need to do, just like the neck and these other areas, we need to get it moving again. So you place the patient on the side just like this. I find the area that needs help. I get in contact, then I'm going to put my hand on the shoulder, and my leg is going to be placed on the knee here, and I'm going to use that to basically bend and twist her like a pretzel, get her to tension where I need her, and then I can adjust it. So, next, bring her hip down. Fantastic. Now we'll flip, give yourself a big old hug. This is the move I like to use the most with the mid-back because it seems to work the best with most patients. So what I do is I have the patient hug themselves, then I'm going to roll them towards me. I'm going to feel around until I find the area that needs help. Then I put my hand on that area, I roll you back onto my hand. I use your body weight and my body weight to adjust you, and it moves nicely. So I'm going to roll it, I'm going to find an area that's stressed, put my hand there, roll it back, deep breath, and down. Beautiful. And we got one more, and down. Good. Good. That's it, Britt.
Okay.
So that's about what you can expect from a typical chiropractic adjustment, a typical chiropractic visit.